Hi friends, hope you're doing well. So today let's read about the Paget's disease, which is one of the bone lesions. Paget disease is also called the Paget disease of bone, osteitis deformans. It is a chronic progressive disease of the bone. Sir James Paget in 1977 named the disease as Paget disease. It is a common skeletal disorder usually seen in middle-aged and elderly people. Here you can see two types, that is multiple bones and single bone. As you have read in fibrous dysplasia, here also there is polyostetic and monoostetic. Polyostetic is common whereas monoostetic is a rare condition. Abnormal and excessive remodeling of the bone is seen here. Initially, increased osteoclastic activity is seen where the bone is resorbed a lot. Abnormal bone formation and increased vascularity of the bone is seen. Bones are enlarged, weakened, and deformed. Disease of the osteoclast, it is also known as. It has increased sensitivity to 1,25 dihydroxyvitamin D, rank L, and interleukin 6. Increase in number of osteoblasts is seen here. Etiology is unknown, hence, but we can tell there are two types which can be either genetic linked or virally linked. Genetically linked can be PDB1 to PDB7. Virally etiology is the nuclear inclusion bodies and measles virus. In the clinical features, we can see it is usually seen at the age which is more than 50 years, that is elderly people, and there's no gender predilection. It is marked geographic predilection that is mostly seen in England, France, and Germany. Usually, it is asymptomatic. If symptom is present, it will be bone pain, bone deformity, neurologic and musculoskeletal, and cardiovascular anomalies. Commonly, it involves the pelvis, femur, spine, skull, and tibia, and these all bones show expansion and deformity. Bone pain is common. Frontal bossing is seen here. We can see the descent of cranium into the cervical spine, calling the platybasia. The skin of the affected bone is warm since the increased blood supply is seen there. Secondary complication is headache, paresthesia, cranial nerve deficits, hearing loss, optic nerve atrophy and blindness, neuralgias and facial palsy is seen here. Moving on to the oral manifestation, there's a progressive enlarged jaw, widening of the alveolar ridge, flattening of the palate. Maxilla is mostly affected than mandible. Teeth may migrate, tightening of the dentures, hence the alveolar bone is widened. Mouth remains open because they cannot close the mouth properly since there is enlarged jaw. So the lips are too small to cover the enlarged jaw. Radiographical features, there are three phases. One is osteoclastic phase, which is also called lytic phase. One is osteoblastic phase, and another one is osteoclastic and osteoblastic phase, which is also called a mixed phase. In osteoclastic phase, we can see radiolucent areas, hence there is resorption of bone going on. In the mixed phase, we can see mixed, both radiolucency and radioopacity is seen here. In the osteoblastic phase is more of bone formation, which gives an cotton wool appearance. Isolated lesion in the skull, it is called as osteoporosis circumscriptae. Cortical thickening is seen here, increased trabeculae and deformity and bowing of the bone. In the lab findings, bone specific serum alkaline phosphatase level is increased, urine hydroxyproline level is increased. It is treated by bisphosphonates. Histopathology, it is again in the three phases, that is initial osteolytic phase, osteoblastic that is subsequent phase, and osteoblastic later phase. So in the initial osteolytic phase there is an extensive resorption of bone and increase in number of osteoclasts. Each osteoclast contains 100 nuclei. In the subsequent or the early phase we can see jigsaw puzzle and mosaic appearance by the reversal lines. In the later phase, we can see bony islands, compact and narrow space filled with highly vascular fibrous tissue. Osteoclastic activity diminishes, causing the burnout phase or the osteoporotic phase. The treatment, no treatment is needed. Aspirin, NSAIDs, that is non-steroidal anti-inflammatory drugs. treatment. There's no such specific treatment required. We can give aspirin, NSAIDs, and acetaminophen for bone pain relief. Bisphosphonates can also be given, and calcitonin is given to inhibit the osteoclastic activity. Complications, we can see if it's untreated, we can see secondary sarcomas, stress fracture in the femur because of the weight, and chondrosarcoma and fibrosarcomas. That's all for today about the Paget's disease. Hope you liked the video.